Hello and welcome. My name is Jyoti Bachani. I'm a professor at St. Mary's College of California and co-founder of the US and India chapters of the International Humanistic Management Association. Thank you for being here and welcome everyone. This is part of a monthly series on the practice of humanism in management, where we invite speakers who have been in the industry practicing humanism to spark conversations. The format is that after I do the housekeeping announcements, I will introduce our speaker for the day, Vivek N Gour. Vivek will speak to us for about 20 minutes, and then we have about 40 minutes for a dialogue amongst us. The lamp lighting I just displayed is in that spirit of how we spark conversations. And it isn't about passing the torch, but it is making sure we light many more torches around to spread the good message of humanism. The mission of International Humanistic Management Association is to make dignity the core concern of management and create societal well-being. Clarification questions during the talk are welcome. Discussion questions we will save till later. And I want to begin with a word of thank you to Ariane, who has single-handedly helped host this series in terms of managing all the logistics of sending information, connecting us, connecting the speakers, me, and all of you for this wonderful hour that I anticipate we will have. With that, let me introduce Vivek N Gour. In 2012, I spent one academic year in India as a senior Fulbright research scholar, and bulk of that time was spent at a company Vivek was the CEO and managing director of, a company called Airworks India, which is a maintenance, repair, and operations management company that maintains aircrafts, including the Prime Minister's aircraft and the private planes and the commercial airlines. And he, in that mission, was trying to put India as a center for aircraft maintenance on the global scale. And I ended up writing a case study as part of my Fulbright experience and spending all those months watching him at work doing what he does best. I got to know him, and I'm very glad that he accepted our invitation to come speak with us this morning. He has 36 years of work experience. He's a graduate of the Harvard Business School's OPM program and has an MBA from University of Delhi. Prior to Airworks, he was the CFO at Genpact, a company most Americans are familiar with. But he literally took it from a small new entrant to the Indian market to what it became in the Indian market, the largest company that provided, that's listed on the New York Stock Exchange, and the valuation was about 3 billion at the time that he moved to Airworks from there. He's currently serving as an independent director with over several companies in India, in USA, and the Middle East in different industries, such as e-commerce, digital services, and of course, aviation. He serves as the audit committee chair at 3 technology companies. And what else can I say? There's a long list of his accomplishments. His current role is with a social impact company that a nonprofit, and I will let him speak more about that. So with that introduction, Vivek, the floor is yours. Thank you for being here this morning to light many more lights and spread the good mission of International Humanistic Management Association.
Thank you, Jyoti. And my thanks to all our listeners who have taken the trouble of attending this broadcast today and taken time off from their tight schedules on a working day. Thank you very much. Jyoti got in touch with me a while ago to speak on you know, humility and humanistic values in management. And I have been through the full gamut in management, from having worked under Jack Welch in the 1990s of General Electric, which was one extreme of management, tough, hard as nails, Milton Friedman, only shareholder value matters, Neutron Jack, and so on, to what I'm doing today, which is providing child health care on a fully charitable basis to not just thousands, but literally millions of children in India. The I thought, Jyoti, maybe I'll quickly walk the group through my organization, which sort of spells out the story of what we do. And then that will also give us a lot of anecdotes on humanistic management.
And as part of the preparation, we had agreed to compassion in the workplace as the topic. I forgot to mention
Yeah,
that.
yeah, sorry. Yeah, compassion at the workplace. Uh, like many of us, or many in the commercial world, my entire career was in business with the Indian Tata Group, then General Electric for many, many years, and then my own business, which Jyoti mentioned in the end was called Airworks. And sometime in 2011, 2012, a friend of mine who has a large heart, strong medical knowledge, he said, I want to set up a hospital in India in the tribal areas to address child heart disease. Child heart disease is a congenital disease that some children are born with, a defect in their heart. They don't survive very long. Most die before the age of 3. He was a very dear friend. He still is a very dear friend. And I said, okay, I'll donate some money for it. And I donated money each year, and he set up the first hospital, which in this photograph is the one in the top left corner. This is in a place called Raipur. Now, why child heart disease? I asked him. I mean, there's cancer, there's eye problems, there are so many things. Now, child heart disease is the disease of the poor. It is caused by malnutrition of the mother, the pregnant mother, from the time of puberty to the time of delivery of the baby. That entire span of 8, 10, 15 years, the malnutrition she suffers. It is also a function through genetics of the malnutrition the mother's mother suffered from when she was carrying the mother. So it is a disease of the poor. Amongst your children and mine, the incidence of this disease is about 1 in 1,000 live births. Amongst the poor in sub-Saharan Africa and South Asia, it is 8 per 1,000 live births, almost 1%, which is a colossal number. And in India, about 250,000 children are born with this congenital heart defect each year. And most of them do not live to see their third birthday because the heart is not functioning properly. It doesn't supply blood to the brain or the rest of the body. So that's where child heart disease came into the picture. Uh, Something I can talk about a little later during our Q&A session. In 2017, I was struck by the fact that I was 55 and all I had done through my life was build businesses and earn money. And I was just reflecting in October 2017 that, the day I pass away and I look back on my life, and what will I say? That I was one more of the $20 million millionaires in this world. I mean, what's the big deal about that? And I sat down and chatted with my friend who had built that first hospital. It was functional. I was a donor there. And I said, brother, I'm going to come over and start working with you free of cost. as a volunteer, and I am exiting my business. It was a decision I took on 12th October 2017. I was very clear in my mind, I'm exiting my business. I'm still a shareholder. I'm still the largest shareholder there, but I handed it over to my chief financial officer, who was my most capable subordinate, and said, brother, you run this business now. You take a share in it, which he did. And I'm out of it altogether. I'm no longer on the board, and other than attending employee events, I'm not involved with the business anymore. So we went on and set up 4 child heart hospitals. Photos of the 4 are here. And we are now, according to All India Institute of Medical Sciences, the largest medical organization for this disease in the world, congenital child heart disease. It has taken us 14 years to get here, or 13 years, and very proud of what we have achieved. But there are a couple of things that if you move to the left side of the screen, I mentioned 9 pediatric hospitals. There are 5 that are smaller. I don't count them. There are 4 major ones. The first thing is we serve the unserved. We want to go and set up hospitals in backward areas in the country, economically less developed areas where nobody else wants to go, because they're difficult places to operate in, either due to lack of resources or law and order situations. The second thing is we decided and put it in our constitution that we will do everything 100% free of cost. No billing counter, no cash counter. We want this to be a temple where the poor can come and have their illnesses, their children's illnesses remedied without having to worry about going bankrupt in the process. I'll move to the next slide. Some of this I covered in the previous slide about 250,000 children being born each year. So we perform medical, as in clinical, as well as surgical interventions on these children. Many of them can be treated with clinical interventions, so they don't need a surgery. But many do, and we have done about 36,000 plus surgeries thus far. We do about 500, 600 a month. And each surgery costs in the market in India about 5,000 USD. But bear in mind, even in the private sector, medical treatment in India, quality for quality, is about 1/4 or 1/5 what it is in the US. And we, along with conducting child heart surgeries and running these hospitals, we also decided to set up training institutes to recruit and train women and young men to be nurses, medical technicians, and that training is also provided free of cost to provide technical occupational skills as well as jobs to the underprivileged in the areas where our hospitals are located. I'll move to the next slide. Thus far, we've set up these 4 hospitals with 17 operating theaters. We have about roughly 1,000 employees now. And I'm very proud that we have completed 1.3 million outpatient consultations, all free of cost. Many of these outpatient consultations involve an echocardiogram or an ultrasound of some kind, which otherwise would have costed these poor people a lot of money, especially compared to what their income is. And here they get it free of cost. And when we say free of cost, it is not just the treatment or the medicines. When these people come, my patients come from faraway villages, they need a place to stay, they need food. So the parents who accompany the child are also put up in a dormitory attached to each hospital, and they're provided 3 meals a day in the hospital canteen. as along with all the other staff members. Otherwise, they have no place to go to. They will have to sit on the streets while their child is being treated. In addition to child heart care, um, we started a maternal mother and child program at each of our hospitals. Because our hospitals are located in very remote areas, backward areas, tribal areas, where sometimes there is no other hospital within a 50-mile radius. And for a lot of the poor people there, then we cannot remain just a child heart hospital. You become the go-to place for anything and everything. So they have nowhere else to go. So we said, let us start mother and child care, deliveries of babies, looking after babies that are born prematurely, and providing uh, nutrition, micronutrients to the mothers in the region who are pregnant to reduce the chances of children being born with defects. This we started only 5 years ago, roughly at the time of COVID. And we've covered about over 500,000 children and done about 10,000 deliveries. What spurred me on to do these deliveries actually was uh, in a couple of my visits to the field camps that we hold, I realized that a lot of these young mothers were dying while delivering a baby. This was not something I was familiar with. And they were dying because there are no medical facilities and there are complications with their pregnancies. The midwives in the villages are not able to handle it. So we said, look, we already have a hospital established here, 100,000, 200,000 square foot facility. Why don't we convert part of it to address young mothers giving birth? Uh, because we are in backward areas, we want to groom people in technical skills, in biological sciences. So we've started a plethora of government recognized nursing and paramedical training programs, medical technician training programs, people who operate an X-ray machine or a ultrasound machine and so on. Some of these programs are for 1 year and some are for 4 years. But we provide all of it free of cost on the campus. We've built a nursing college, associated hostels, and because we have so many patients coming in, we, along with government, as per government regulation, we take the sample of their heart tissue. And unbeknownst to ourselves, we've created the largest biobank of a congenital heart tissue in the world now. And we are using it to do research to see if there's a connection in this genetic link and that can be addressed. I'll just pause here for any clarifications before I move to the last slide.
In the training programs for paramedical nursing and stuff, are they obliged to work at the hospital during or after?
No, they're not obliged, though many of them do get absorbed by us. And we have made arrangements with several renowned hospitals in the country, like Tata Cancer Memorial, for example, who take up the rest of the students. So all of them get placed, but no, they're under no obligation.
And in following government regulations, is the government supporting this work in any way?
No, no. They would like to, maybe, but in India, getting involved with the government is usually a bother. I don't want to get entangled with bureaucracy or then having local politicians push me around in these remote areas that we operate in. So we stay out of the way of the government, though we have good relations with the district administration or the state administration wherever we operate. But we avoid taking help from them in any way. Thank you, Jyoti. If there are no more questions, clarifications, I'll move to the last slide. The work we have done so far is about $180 million, give or take a little, maybe $200 million worth of work for the poor, for the needy, to save lives of young children, and now to also help young mothers to be who have babies to deliver and have some complexity in their pregnancy. And you don't just save the child, you end up saving the family also. Because what happens is if there are three children in the family and one child is fatally ill, all the resources get transferred to that child, and these families are so poor, it means that the other two get pulled out of school. Or they are cutting back on food or something of that kind, or they're selling off their farmland to pay for the treatment, and things like that start happening. So you end up really saving the family more than just the child. That is my work now, more fulfilling than building businesses, more fulfilling than creating shareholder value for private equity and public investors. And I'm very glad I was hit by these thoughts in October 2017 and just decided to act on it and move on. Thank you very much for listening. I'll pause here and I'll be very happy to take questions.
I have the right to ask the first question because this is your life since 2017.
Yeah.
I remember the Airworks business vividly since I wrote the case study on that. Could you also take a few minutes to tell us a bit about that and your stint at Genpact?
So Airworks was effectively the first maintenance repair organization in the aviation sector in India. And we built it up from scratch to, at that time, to about $125 million revenue company with work for mainly the commercial airlines, but also for the defense, as well as for private business jets. And I realized that engineering does not pay as much where profit margins are concerned as information technology, which was my earlier business in Genpact. And Airworks continues to grow. It has done well under my successor. And next month, literally next month, the Adani Group, which is a very large business group in India, is buying the company out, lock, stock, and barrel. So it was, in the end, it has been a good story, though it had its fair share of challenges in between. On Genpact, Genpact was a business offshoring information technology company. We started it in 1996 and grew it over 10, 15 years to about 3 billion. And it's now a global company across 13 countries. I left in 2010 because of differences with the CEO, whom I'd worked with forever. And that's when I said, let me do some business of my own, and got into Airworks. Genpact, even at that time, was a large company employing about 42,000 people, including at that time 3,000 in the US. Today, it employs about 100,000 people. I was a shareholder there, but I've sold my shares a long time back.
Thank you, Marty.
Yeah, I have a couple of questions besides saying it's great to see this worldwide effort. So many wealthy people now towards the end of their career are becoming involved in these great charities all throughout these developing countries. And it's very impressive to see people with money doing this. I have a question regarding kind of uh, what is the reputation of this effort, this treatment program? It obviously within India has been very successful and drawing students and both patients. Uh, what has been the response more globally, say with the World Health Organizations and stuff, for this kind of effort as a model for other charitable investments into poor areas? Is it being duplicated, maybe outside of heart disease and other areas, or is it kind of standalone?
That's a great question, Marty. Thank you for it. Uh, no involvement with World Health Organization in particular, but we have received invitations from 4 countries, the governments of 4 countries, to set up something similar in their country uh, that would run on a wholly charitable basis, except that over there, the government ensures that the funding gets done. I don't have to look after the funding. So this was Malaysia, Sri Lanka, Fiji, of all the places, and Nigeria. And now we've been approached by the government of Rwanda, small company, a country in East Africa, to set up a hospital there. In all these cases, we set up the hospital, trained the staff, and even today, I regularly send doctors and high-end nurses to help the missions over there and to, continue a process of ongoing trainings, including bringing their doctors over to India so that they work with my staff for a few months and upgrade their skills. So that's what we have done. It's a difficult model to replicate because of the funding and keeping it wholly charitable.
Right.
But at least in these 4 countries, it has worked very well.
I appreciate that that answer, and I'm hoping that young health professionals who are often looking for very meaningful employment seek out these kinds of opportunities, even if they don't work for you, a long time, even if they just do it for 4 or 5 years to get that experience, that could be invaluable for them and give them this very compassionate approach
Yeah.
to medicine rather than just capitalistic, make as much money as I can.
Yeah. So you've touched a very good point, Marty. So of course, my employees don't work for me forever. They basically come to us for the training they receive and the exposure. Uh, and then they move on to private sector or overseas or wherever. But every year, or about 3 times every year, we conduct special missions in India in remote parts where no other hospital exists.
Yeah.
And my ex-employees almost always volunteer to come to run those missions. So I may just have 1 or 2 doctors who are in my full employ running those missions, which may be for 3 weeks or 4 weeks in the middle of nowhere. But most of it is run by my ex-employees who come as a service, which tells me that we touched something in their heart along the way. I often tell them that, we may be operating upon that child's heart, but the real transformation is in our hearts that takes place in the process. Certainly it did in my case.
I think you'll lay on your final breathing moments now with a real sense of having accomplished something that many people don't do in their life, and you'll go peacefully, I hope.
Well, I can't take all the credit for myself. Of course, this is my team of 1,000 people, and we are actually 3 partners who run this together. We are joined at the hip. One of them is Dr. Srinivas, whose original idea this was. I must admit, this was not my idea.
Yeah.
There's me, and there's a third gentleman called Sunil Gavaskar, who is a famous sportsman in India, or retired sportsman, I should say.
Yeah.
He plays cricket, a game that is not known in the United States, but very popular in some other parts of the world.
Thank you very much.
Thank you, Marty, for your questions. We'll be happy to take more questions from all of you. And a little later, I'd like to share some anecdotes that may touch you.
So my Zoom is giving some.
Sorry, Vivek, you can stop the screen share so we can see the speakers.
Yeah. Just
And I'm going to put a link in the chat window to Sunil Gavaskar for others to know who your third player is. Neeraj, sorry to interrupt you.
No, sorry, my hand gesture thing is not quite working. But thank you for such an inspiring story. I think it really is inspiring. I began my career with Tata Steel in India before becoming an academic in North America. So I can quite understand some of the uphill battles you must have faced in India in setting this up and bringing this to this stature and fruition. So that's phenomenal. I don't know very much about the industry to be able to ask, anything of meaningful worth about this. But as an academic who's interested in this organization that tries to bring humanism into management, I think if one were to look at your story, there is a wonderful element of sequencing. As you've said, that in the first part, you need to learn the ropes, you go through the business model and so on, and you become successful in it. And then, as a seasoned professional, because of a conscience thing or whatever reason, you move to a different thing where the humanistic is more apparent. It's a very commendable and a fantastic story. But is there a kind of sign in your early career that somehow some level of humanism was prompting you towards this, even though it may have been nascent or unspoken or whatever, or even in other people? Is this the sequential model is helpful, but not everybody is as successful in a short period of time as you've been. And is injecting that, right? Please.
Yeah. Thank you for those points, Neeraj, and good to see you also worked with the Tata Group. I don't know if there was any sign in my early years. I really don't know. Though I had thought more than once that at some point I'll sell my business and donate monies to charity. What, when, where, how, I hadn't really thought any of it through at all. The second is I would resist the temptation of putting someone who creates a charitable institution on a pedestal. I'm just, any one of us can do it. And it's just a function of putting our hearts and minds to it. I actually just view it as another organization I'm building. I helped build Genpact. I helped build Airworks, which we are now selling to Adani's. And now I've helped build a chain of 9 hospitals, and a couple of more are coming, are in the works. So I would not rate myself as a person like Mother Teresa with deep spiritual, strain. But when you work in charity and you work with the poor and the difficulties they face, and the poor are not always happy or pleasant people to work with, I'll tell you. They can test your emotional reserves to the limit very often. But all of this does change. As I said, your own heart gets transformed in the process. Did I miss out something in the points you raised? I'm sorry.
No, I get the sense of what you're saying very clearly and well, and I wasn't necessarily putting you on a pedestal, but
Thank you so much.
but I was admiring what you're doing. But the real question is, how do we interject this spirit in the day-to-day operations of business, as opposed to a transformation of a career in?
Yeah.
That's my
Businesses in earlier, say at the first half of the 20th century or the latter half of the 19th century, no, not all businesses, but many did have this sense of that we have to give back to the community, that we have to help develop the community. Somewhere along the way, I would say from the 1970s or 80s onwards, Milton Friedman's sort of philosophy that only shareholder value matters is what has given rise to the environment we have today, not just in the US, but in most parts of the world, where market capitalization, return to the shareholder at all costs. And that, I believe, is not necessary. You can give a reasonable and decent return to your shareholder while remaining fair to other factors of production like your vendors or the employees who work for you. But this has become a culture. As I said, I worked in Jack Welch's era at General Electric. I saw it firsthand. I enjoyed it. I was successful at it and I enjoyed it. And I thought that is the way to run a business. So I think we as a society as a whole have to move away from it, because there are millions upon millions upon millions of human beings who cannot relate to large businesses, who have far more basic issues to solve, far more basic. And having worked in Tata Steel, and I'm sure you moved around what is today Jharkhand, the problems to be solved are so fundamental. Shareholder value is completely nonsensical in that context. Thank you.
Thank you. Thank you very much.
Thank you so much, Neeraj.
Vivek, at the time that I was doing the research for Airworks in your office, I was writing the book on strategy making in nonprofit organizations. And a
Yes.
number of the people we interviewed for that had moved from business to nonprofits. And in nonprofits, they were often told to run it like a business because business is successful, efficient. And yet, I learned from that engagement with 12 different case studies that nonprofits had a lot to teach business. And before I say what I put in the book, what would you say you have learned from running these hospitals and being in the nonprofit world that you would bring back to teach to people running businesses now?
One reason people say nonprofits should emulate a business is because businesses are well organized, well structured. Now, that was the world I lived in for a very, very long time. And I realized that in non-profit, getting that organization together is not difficult if you have the right management talent. And in my organization, between Dr. Srinivas and I, we definitely have the right management talent. Bringing in love and bringing in empathy for people who are weaker and needier than you is actually the difficult part. My hospitals are as well organized as any global chain in look and feel and efficiency. But the piece which I have had to put in the maximum effort, me and Srinivas, has been in bringing love and empathy into each of our employees. That the only VIP in that hospital is that infant child who comes in for treatment. The trustees, people like me, or the doctors, or the government officials who turn up occasionally are not the VIPs. It's only that child.
And
We,
VIP is the very important person.
okay, sorry, my
With
apologies.
Indian jargon.
Yeah.
I haven't heard that in America in a long time. So I just thought
Global South terminology, very important person. And teaching our employees to treat the parents of the patients. The patients are all very tiny. They're 3 weeks old to 3 months old or whatever. But these uneducated, rural, illiterate parents who come, to treat them with dignity is the piece which requires huge amount of effort. A hospital is a very tense place to work in because you're dealing with life and death. And it's very easy to get irritated with the parents of the patients when they don't understand what you're trying to tell them or the rules they have to follow. They're already fairly traumatized because that child is dying, literally dying. So it is this transformation of the heart and bringing in humility in the organization by practicing it ourselves first, which is the tougher part by far. Businesses don't often have that. So they think getting organized in an efficient way is the way to go. But getting organized in an efficient way, if you're a capable person, is no big deal. On a shoestring, we have built 9 hospitals. In places the government hasn't been able to build hospitals, literally. For example, we have a hospital in a state called Chhattisgarh, which has a lot of, Jyoti will have to explain this to you, Naxalite movement, which is, Jyoti, how would you explain Naxalite movement to our guests?
long-term committed, partially violent activists.
Yes, very
working
violent.
for human rights of the disenfranchised.
Yes, yes. And these are in jungle areas, very thick jungle areas. Once you get off the main road, the writ of the government ceases. It is the writ of the Naxalite movement that runs once you get off the main road. And they have told us, I go there very often, Bastar district it is called. They have told us that we will never touch you because we know who you are and we know the work we are doing. But if you ever come here with a government servant, we will kill you. I have these things on my WhatsApp message, you know. I said, okay, fine. We are here to serve your children and, you know, we have nothing to do with the government. So it is this compassion, the desire to help, which is the difficult thing to do. Do we have more questions? Otherwise, I'll share some anecdotes with the group.
Go for it.
Okay, Jyoti, how much time do we have? Maybe 10 minutes more?
Total, yes.
Okay, great. So I'll take 5-6 minutes. Let me share Jyoti, if I can do a screen share.
Of course.
I'm not sure if you're being able to see this carefully.
Yeah, we can.
I'm just sharing one of so many stories we have. So this is a baby whom we christened as Divyansh. He's now an American citizen, by the way. This photo is of around 2020 or so. This child was born with a defective heart, and for reasons we don't know, his parents dumped him in a garbage dump in the middle of winter in India, near the city of Agra, where the Taj Mahal is. He was picked up by the police. He was what is called a blue baby, which means that his blood is effectively not circulating through his veins. He was taken to a orphanage, a privately run orphanage run by some charitable institution in Delhi, and the doctors told the institution that this child can't survive unless you can have his corrective heart surgery done. It's not a common skill available in India. Private hospitals don't like taking it up because there's not so much money in it as in adult heart surgery. I do not know how, but the orphanage got in touch with me on the phone one day. And this child was uh, less than 1 year old at that time. Anyway, I said, we'll send the ambulance, we'll pick up the kid, we'll give it our best shot. And if the kid doesn't survive, you have to understand this is a touch and go situation. Anyway, long story short, the child got treated. He was with us in the ICU for almost a month. And later, this baby got adopted by some couple in the US, some white couple in the US. And around 2022, 2 years later, he pushed off to the US, which is where he lives now. We have it on record where he is. Offhand, I don't remember. But this is just one example of the impact the work has on children who otherwise would have had no hope. And I'm sure this child will do well, and I hope he makes something of his life and the great opportunity he's got. So from a garbage dump, literally a garbage dump, to a home in the US, I think is quite a journey. What a fate this child has. I also wanted to share with you that when you do work for humanity, the forces of the universe coalesce to help you. Forces from unexpected quarters turn up at your doorstep. As we are a charitable institution, we raise money every month from different sources. Sometimes the money gets delayed. Sometimes people make promises and they break it. Our burn rate is about $1.5 million a month, which in India is a lot of money. The dollar goes about 4 times further in India than it does in the US. And in February 2022, somebody who had promised money backed out, and it was Saturday, the 26th of February 2022, and I was really up the creek without a paddle because on 1st March, 2 days later, we had to make the payroll. I was just saying, God, you need to take care of this, literally. So on a Saturday night at about 9 p.m., the phone rang from a number I did not recognize. It was the chairman of a foundation in India called the ICICI Foundation, the foundation of one of the largest banks in the country. He introduced himself and he said, look, we've heard a lot about you. We have certain commitments of, corporate social responsibility we have to fulfill. We have missed our targets. India follows a calendar financial year that ends in March. The year end is coming. Would you be able to absorb $800,000 if I give it to you right now in the next 5 weeks and do an appropriate number of surgeries sponsored by us? So I said, yeah, there's absolutely no problem. It turned out that some classmate of mine had given our reference to him. And next day, I flew down to Bombay immediately to sign the documents. And bingo, we had about $850,000 in the bank, which helped me make my payroll. This is a gentleman who called me out from the blue. I had never heard of him or met him before. It's just an example of how people get together to help you. I'll give you another example. We were building our third hospital in outside Mumbai, Bombay. And as often happens with charitable institutions, we ran out of money when half the hospital was built. We just ran out of money. Commitments that were made were not kept. I didn't know what to do. So this was around 2019. Now the contractor to whom we had given the job, the builder, good man, I had never worked with him before, but he realized in that time what we were and what work we are doing. He had seen our other hospitals because we had taken him around to say, hey, this is what we do, and this is what the hospital has to look like in the end. And I told him, I said, brother, I have no money left, and it's going to take me 7-8 months to raise, the $3-4 million required to complete the hospital. So do you mind waiting till then? And he turned around and told me one day later, after consulting his brother and father, and he said, we will complete the hospital for you. You don't have to pay us. We will complete the hospital for you. And he did that. Now, since then, he built our 4th hospital and some others. I would have never expected this from a supplier, straight out of the blue. Well, he completed the hospital, and good for him. So I'll pause over there, and if there are any more questions, I'll take them and then hand over to Jyoti.
Caroline, did you want to unmute yourself to ask the question? She put a question in the chat window. How did you move from Jack Welch's approach to business management to your current model?
Oh, I don't know. I think sometimes a switch turns in our heads. A switch just turns in our heads. And maybe it is predestined. Maybe it is our karma from earlier lifetimes that's flowing with us. I really don't know. I was just sitting in my drawing room, scrolling through emails, feeling very frustrated with some business situations. And on 12th October 2017, and I thought to myself, there has to be something better to do in life than running a business, which my children don't want to inherit. They want to do more exotic things than grease on the hangar floor. And what am I doing this for? Just for a couple of private equity guys who invested. And I just walked up to the dinner table, and my wife was there. And I said, look, I am exiting my business. And I'm going to talk to Srinivas and say, you're building your 2nd hospital, I'll come and help you complete it. And fortunately, she was very cool about it. I said, there'll be loss of status, mind you. There wouldn't be loss of financial standard of living, but there will be loss of status. I'll just be another retired bozo doing some social impact work. She said, yeah, that's fine with me. And that was it. And yes, there was loss of status, and it did hit me badly for 1 year. But I don't know how better to answer this question, ma'am. There was no, that was just it.
Thank you for sharing that story of your personal transformation. We have the last 5 minutes for this session. I would love to hear from people who have attended, whatever your reaction is. If you can unmute yourself and let Vivek know what you're taking away. And I will meanwhile share the link to my book, which I wrote literally in the office space provided by Airworks. And Vivek feeding me lunches at the company where he fed all the employees lunches.
Yeah.
And my thesis supervisor, Sumantra Ghoshal, was well known for talking about strategy and how companies need to structure themselves to implement their strategies, and the systems need to be built for corporations, but he also said companies aren't just economic entities, they're also social context in which we human beings function. And he advocated for top management's role to be one of setting the purpose. So the book that I wrote about nonprofit management says, let's move away from strategy, structure, and systems as the only way to build organizations to saying, what is the purpose, why we are organizing? Organizing is a verb. What is the process that we use? And get the people to commit wholeheartedly rather than giving 10% at work. Are they able to give 100% because they believe in the purpose and they know why they're organizing and the process? So that's what the book says. And the big lesson for me in doing that book was leaders in the business world often are in the broadcast mode of saying, this is what you should do. They use power in the carrot and stick model to say, I'll reward you and give you bonuses and promotions, or I will punish you if you don't meet your targets. In contrast, in the nonprofit worlds, leaders listen. The Boy Scouts of America leader is not at the top of a hierarchy, they're at the center of a circle. And they work through influence because they work with volunteer parents running the various troop groups. There is no carrot and stick approach there. And the definition of power in the nonprofit world is you have power if you uplift somebody else. So if you're uplifting others is your definition of power, it just completely changes how you organize and how you treat people and the purpose for which organizations are formed. We're not just human resources for organizations. We are the ones who organize towards serving unmet needs in the community. So unmet needs that are so dire, where it's healthcare, water, food, shelter, nobody's advertising to say, come serve this. And we don't have the gumption to go confront it because it takes a large heart to be able to deal with that level of human desperation and need. So thank you, Vivek, for making that switch and for sharing your story. Really, really inspiring. I have used the Arvind Eye Care case study in my classroom a lot. And this is another case study I would love to see written to be able to use in the classroom. So any of you in the rooms who have PhD students willing to write case studies or others, please, I'm happy to make the connections. And I really appreciate all your time this morning, and I'll shut up now so you can all have your final words of gratitude for Vivek and for your time this morning.
Jyoti, if I can just intervene, I just looking at the questions, and I'll very quickly answer two which have not been addressed, if you allow that. One is Radmila is asking about Rotary. Yes, Radmila, Rotary does help us a lot, approximately in the order of about $1 million per year. I'm a Rotarian myself, and we work closely with Rotary clubs in India, the United States, and Singapore.
Thank you.
Thank you, ma'am. The other question is by Nathaniel Amoha. I hope I'm pronouncing your name correctly, sir. On would you say that humanistic management naturally flows in nonprofits, or does it require some effort? Sir, it requires a lot of effort. It does not flow naturally. Human beings are what we are, and people have to be coached, trained by example, by effort, to develop a soft-hearted approach to the recipients of the benefits. Sorry, Jyoti, over to you.
Thank you.
Neeraj, go ahead, share the quote.
I just put a quote in, which is from Immanuel Kant. I may not remember the exact words, but it's close enough. It says, some things have a price, other things have dignity. Right? I've always loved this line from Kant because and in my class, when we talk about, reductionism and market value and so on, we are confronted with ideas like, should blood sold? What about organ transplants and so on? And there is no, it's legally forbidden, but I suspect it goes on, especially organ transplant in India and elsewhere. And the quote from Immanuel Kant is so relevant that, this has organs have a dignity about it, and that giving of an organ to somebody else is an act of dignity. It cannot be converted to a transactional kind of thing which has market value. And I think Vivek's, Dr. Gour's presentation reminded me of this, because in some ways your early and late careers have had both, there's an intermixing of both. I hope that, after this, you'll write something about the question that somebody asked you that you said you didn't know the answer to, but I suspect there is an answer somewhere as to, if we make it a conversion experience, then it becomes unanalyzable. And really, the only way of learning from that becomes like a act of reverence rather than an act of reason.
Yeah.
And I'm sure there's a lot of stuff about it, but you haven't probably minded fully. And I hope that for the rest of us, and for the sake of this field, that you'll go back to thinking a little bit more about what were some signs, what were some things that actually were lurking in you, and rather than a kind of sacred conversion experience, to give a more continuing answer to that question.
Thank you.
I love leaving the speaker with a question to think about. I inspired by your quote, Neeraj, I will share that some of the most valuable lessons I learned came from my grandmother or mother. And my grandmother never finished her education beyond elementary school. And yet she was one of the wisest women. And one of the quotes, similar to what you shared from Immanuel Kant, that my mother often said, some things have a price, the other things are priceless. And when something is priceless, then you should not put a price on it. And mothering is one of those things that's priceless, because if you add up the value of being the driver, the cook, the cleaner, the laundry woman that you are to your children, I think in business they've calculated it to be $135,000 job. Nobody's paying any mother that. And I hope they don't. I hope some things remain priceless forever. So thank you, Vivek, and thank you, everybody. I'm going to stop the recording, but keep the room open to honor the time that everybody had committed to it. So thanks, and see you next month with another episode.